In October 2010, the Center of Disease Control reported approximately 300,000 people die of out-of-hospital cardiac arrest each year in the United States. Of these 300,000, only about 20 to 30% receive any bystander CPR. Survival to hospital discharge is as low as 8%. If I were to take a time machine back to the 1980s, we would find that survivability from sudden collapse cardiac arrest has not changed at all. Despite the evolution of technology and having defibrillators available in the schools, at public buildings, at town hall, you might ask the question, why? The reason is simple: people just fail to act. In my 15 years of pre-hospital experience, I would say of the survivors that I have encountered, survivors have had return of spontaneous circulation prior to my arrival due to the heroic measures of bystanders and first responder EMS. Time matters. Every minute matters. In the next few minutes, I'm going to show you how simple it is to perform simple bystander CPR. The steps include: do they require CPR? How to perform effective cardiac chest compressions, and how simple it is to implement an automated external defibrillator. So I'm going to position myself next to this patient, and the first thing you want to check is if the patient's responsive. Sir, are you okay? I should be checking for if there's any signs of breathing, such as chest wall movement, or if there's any gasping respirations. If gasping respirations are heard, that is ineffective breathing and should be deemed not breathing. The patient should be deemed not breathing. If I cannot get to a phone immediately, I should do it now and try to make that 911 call to get help on the way. If I have a cell phone, I could use a cell phone, but you want to start EMS immediately before you start the sequence of cardiac compressions. So, no response. I have EMS on the way. The other thing I might want to ask for is an automated defibrillator. If there is a bystander that can help you, and you can explain to them, I need the automated defibrillator, the box on the wall that's usually yellow or red in color. If they can bring it to you, that would be very helpful in the resuscitation. I'll explain that a little bit later. So, the patient is deemed unresponsive. The next thing I'm going to do is open up the shirt. So I open up the shirt and I expose the bare chest. I'm going to landmark my hands just between the nipple lines. I'm going to interlock my hands, and I'm going to get nice and comfortable over the patient. The best position is probably not to be on the table, but to get the patient on a hard surface such as the floor. You compress approximately 2 inches. Compress and release, allowing the heart to recoil, allowing it to refill with blood, and I want to go about 2 inches in depth. I want to go to a faster rate of about 100 per minute, about the rate of Staying Alive, the song Staying Alive by the Bee Gees. Okay, so that would be effective CPR and cardiac compressions. I would not stop this until a professional rescuer arrives or somebody else can relieve me. All right, I want to go about 2 minutes if I have somebody else who can help. If a defibrillator does arrive, the AED, then I would stop to attach that device. Okay, so that's the steps of cardiac compressions, and a bystander now comes in and brings me the automated defibrillator. Very simple to use and very important in the arrest. If you do compressions, it's kind of like putting gas into your car. All right, your body needs fuel. I'm putting the gas in by circulating blood flow by compressing the heart. I bring my defibrillator, that's like turning the key on the ignition, all right? I'm not going to go anywhere without any gas, and I'm not going to go anywhere without my keys. So you need to implement these 2 things to have a successful resuscitation. So easy enough, it's just 2 buttons on this device. It's on and off. You can see here it's on and off, and then the bottom button right here is the shock button. It is intimidating, but it's so very simple. If you can just remember to turn it on, it's going to tell you what to do, and it'll turn into your coach, your life coach. So I turn it on.
Apply pads to patient's bare chest.
And I'm going to open up the defibrillation pads that say adult, because this is an adult patient. I open up the pads, and I'm going to attach them.
Apply pads.
Just
Plug
like the
in
pictures
connector.
show here. And I'm going to take the plug and I'm going to plug it right
Apply
in.
pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
So, as the machine goes through, it's going to tell me
Shock advised.
whether or not I need to deliver
Charging.
defibrillation.
Stay clear of patient. Deliver shock now.
Deliver the
delivered.
shock. I'm going to make sure everybody's clear of the patient,
Pause.
nobody gets hurt, and that's as simple as it is. I have demonstrated now the necessary steps in a successful resuscitation. Who needs CPR? How to do proper cardiac compressions, and how to implement the AED into your resuscitation. Doesn't take a card in your wallet to become a hero. There's variation as much as 5 to 50% in terms of people's survivability from system to system, typically because people don't act. I've demonstrated in the last 6 minutes how simple it is to do a resuscitation. Now the question becomes, will one person help another in their darkest of hours?